Okay, Bismillahirrahmanirrahim. Thank you very much for Committee International Conference and on Midwifery and Health Science. Now I want to explain my research study with the title Non-Pharmacological Pain Management in Labor is a Literature Review. From the research background, I will take our research background. Almost of women feeling pain that occur are in the lower abdominal, back pain, iliac crest, buttock, or thigh. But it's uncommon of case women experiences badly within perception of pain, so it can be causes anxiety and problem in the delivery process. Although normally many women consider of it as a problem in labor, then pass of them to choose cesarean and anesthesia in childbirth. Based on the data recorded that women in Indonesia, 21% said that the birth experiences were labor which painful. So they need management of labor pain are needed to reduce the pain, and maybe non-pharmacology more safely than pharmacology treatment to choosing in the reduced labor pain. From the biological background, but spine is naturally processed in labor. It appears from contraction and dilatation are causes experiences of pain in labor and delivery process. In the last of age of pregnant, the fetus is distended and cause distension of vagina and then the pelvic floor and perineum. So the stimuli of the pudendal nerve, anterior primary division of sacral, in the sacral to until sacral 4. So it causes for the pain in labor. This research study is a literature review. The data was collected by database journal divided as a Cochrane library, PubMed, and Clinical K, and the data was collected by inclusion and exclusion criteria. So in the last of the collected, the number of articles, that quality review, amount of 8 article. Here study results. Can see for the table 1, the average of pain intensity of maternal childbirth. We can see from this table for the all of the treatment, was yoga is significantly effective to reduce pain labor in the latent phase and deepest labor. The data was shown if yoga are benefit to reduce pain of labor in the latent phase. Was obtained mean value 2.63 and the value 0.01, and in the active labor, the second examination was carried out of 3 measurements obtained and mean value of 3.9 and p-value 0.00. And then, if aromatherapy, the most effectively to reduce pain in the latent 4-stage labor, the result from value measure with mean value at 188, but is not effectively to reduce pain in active phase labor, then yoga with compare mean value 5.45 at aromatherapy is then highly from between yoga is only 3.9. And then based on the table was shown the high intensity level of pain in the first stage labor obtained at yoga. This involved from Bolantakodi and Gitti research. The data was shown the level intensity of pain obtained at level 60.43 in the first stage labor in the latent phase and 94.43 at active phase labor. Yoga was effectively to reduce pain of labor that did intervention at gestational age 26 weeks up to 37 weeks. Yoga exercises are done 3 times a week for 60 minutes. Each patient is given a booklet and DVD, and then is not effectively yoga for reduce pain in labor obtained at group intervention that did for 30 minutes of yoga exercise. At did in the 30 up to 39 weeks of gestation for 3 times a week. And then the effect of aromatherapy significant to reduce open labor. The researcher over respondent to choose the aromatherapy to be used. There were four choices from the aromatherapy is the lavender, rose geranium, orange, and jasmine. Were given 4 drops of aromatherapy in 300 diffuse water. The intervention did at lifetime and active pace for 3 times measure. And mechanism for yoga and aromatherapy. The function of yoga is train the mind and body is becoming increasingly recognized as a health practice to reduce pain, improve psychological well-being, and reduce the frequency of positive mood states and optimism and physical fitness. And from the aromatherapy is a herbal medicine for its relaxation, antioxidant, antibacterial, and anti-diabetic properties. Okay, the conclusion in the research study for the literature review is a non-pharmacological therapist that can be used to reduce pain. So, in addition to reducing labor, non-pharmacological therapies also provide positive effect. They are beneficial to provide peace of mind and mind, increase normal delivery, and reduce delivery by cesarean. Maybe enough from my presentation. I say thank you very much from overall, and I say wassalamualaikum warahmatullahi wabarakatuh.